And I am honored to stand in front of you and listen to such wisdom in times such as this. My name is Korola Maluleka, so the only prayer I had was yours.
Kalina Nake Enita Khaye. I'm from Lifeline South Africa. Lifeline South Africa is an NGO organization dealing with emotional wellness. So what we do is we do telephone counseling. Telephone counseling, our lines operates for 24 hours.
Yeah.
And if you need intervention in maybe face-to-face counseling, we can refer to the nearest center from wherever you are. Because right now we are based in Johannesburg, Emarancia, but we have branches. We have one in Pretoria, we have Mafike, we have KZN, and almost all the provinces. So what we do is that if in most cases, actually, one day you don't speak.
Yeah.
One day you don't talk to anyone when you're going through stuff. When you are not okay, you bottle out. You keep things to yourself, and that is not right. It can't be business as usual if you're not okay. So Rona, we are here to say we are there for you. Whenever you need someone to talk to, whenever you need to vent out, reach out to us. Our lines operate for 24 hours and they are for free. Even if you're not calling, you can use a WhatsApp. There's a number on this pamphlet that you can use. It's 0800 150 150. You can use that number to either call or send a WhatsApp message. And also, we are well aware but they go through gender-based violence. That's why we call it gender-based violence, because everybody is included in that. And sometimes I'm being abused, I'm being sweared at, and stuff like that. We are there to assist you. If you go to a police station to open up a case, and mapolisa ba o thega, they don't want to help you, ba bolela gore ha o ntate o yang o shapuang ke mosadi o mosadi a mo etsa eng. Please don't leave that police station without being assisted. If they refuse to assist you, call us. We are there 24 hours. We are able to intervene on the spot. So you can take these pamphlets, share it with people in your church or at home, because you might be knowing somebody who's going through what we're dealing with. So at any time, feel free to reach out to us. Like Rona, we are also mandated by Gauteng DSD to go to churches and higher learning institutions of higher learning. So if there's a church for West Rand and needs our services, please do reach out. If there's a church in East Rand or City Bank, please do reach out to us. We will come through.
Baptist Church. Thanks for giving me this chance. Because of time constraints, I'm going to cut it short. But what I want to tell you is that I'm coming from a different angle altogether, that is of wealth. And the wealth is that of health. Because many people ignore their health, and they don't know that if you don't have health, you don't have wealth. You can be how rich, you can be how educated, but if your health is down, you are almost, you don't belong. Let's put it that way. And then I was going to talk about the silent killer's disease, which is metabolic disorders, and chronic fatigue syndrome, which is attaining many men, and then cancer and how we acquire cancer and how we can at least mitigate not getting cancer at an early age. But now I'll cut the last two. I'll deal with the metabolic disorder, because I've realized that these silent killers are the leaders of mortality nowadays. Like, okay, let me do this. Right. As you know that men's health is very important. It's a family issue actually. Not if a man is ill in the house, the whole family is sick. Like if You are sick. Your wife is going to be very concerned about your illness. Your mother, your father, your daughters and sisters. And then this shows that men's health is really a health. I mean, it's truly a family issue. It's not an issue of how emotion or an issue of for the pastors to come and pray for you, but it's that of the family. So it's very important that the surgery to go on a tata. Right. There are these metabolic disorders which I would like to speak to. Now, to define a metabolic disorder, it's a cluster of health conditions that usually occur together, increasing the risk of developing heart disease, stroke, and type 2 diabetes. Now, these conditions comprise high blood pressure, elevated blood sugar levels, excess body fat around the waist, and abnormal cholesterol or triglycerides levels. Now, detecting this is very necessary so that you can not go into having to get metabolic disorders like diabetes or hypertension. Now you ask yourself, which are these metabolic disorders? And they're all silent. There are about 6 or 7 of them, which I think we must address, and then I'll give an advice as to what to do about them. We've got hypertension. I was very scared when I read the stats about what is happening in South Africa when it comes to hypertension. I was looking at the growing epidemic and evolving treatment paradigms by the World Health Organization. Now they say, according to the World Health Organization, hypertension affects an estimate of 1.2 billion people worldwide. And then those are adults between 30 and 79 years of age. Now, with nearly 2/3 residing in low to middle income countries, despite its burden, 46% of adults with hypertension are unaware. This is scary. Well, I don't know, but we are here. I don't know if you're 100 here, 46 of us are unaware of the fact that they've got hypertension. And if you're diagnosed, less than 42% of those go for treatment, and the rest don't go for treatment at all. And among those who are on treatment, 21% of them will achieve target of controlling their blood pressure. This is a very small number. So meaning that 79% of people diagnosed and not diagnosed will have sequelae of hypertension, which will come to just now. So I think it's very important that we should also be taking care of our health. Not only our spirituality, but our health. The second one is diabetes. But before we come to diabetes, I would like to address the main symptoms that you should look out for to find out whether you've got hypertension or not. They will be the following. Changes to your mental function. Hypertensive people have got a cognitive ability or able to form other people with normal hypertension. Now, chest pains. Chest pains are very common among young adults, especially now between the ages of 45 and 75, 45 and 75. Well, 75 years is not easy, and it's not the young man. And then dizziness, edema, that is swelling of the legs, or swelling of the abdomen, which is called ascites. Heart palpitations. If ever you are seated at home or watching TV and you just feel that there is something going on into your chest, you just feel like you are missing beats, those are called palpitations. It could be a sign that you are getting blood pressure. Now, peeing less than usual, that is oliguria. That is also one of the symptoms you should look out for. Now, if you are at this stage now, just know your kidneys are being affected. And then seizures sometimes, because of very high blood pressure, can cause it to go into convulsive state. People may perceive it to be epileptic when you are not. And severe headaches of unknown origin. So you get a headache, a very throbbing headache, and you can't even sleep. It wakes you up at night. So immediately you have all the symptoms, please seek medical attention very quickly. Then you will ask yourself, what really causes these things? We don't know really what causes low blood pressure, low diabetes, and all these other metabolic disorders. But all this, which I'm going to show just now, are attributed to smoking and an environment which is very smoky, like in an industrial area. Now, being overweight, which is obesity, that is the second thing, it will predispose you to a metabolic disorder, especially hypertension and diabetes. And a lack of physical activity. Coming back from home, sitting down with a remote control, watching TV from 6, 7 up to the time we go to sleep. That is bad. That is not good. We got a problem of salt, too much salt that we really take. Because there are some other people have realized when you go to a restaurant before, somebody will put a plate in front of you before you even eat. I mean, before you even taste it, already put salt inside there. Now, drinking too much alcohol, which is about 1 to 2 drinks per day, that will lead you to states like this. Now, older age, unfortunately, you can't run away from that, but let's say a lifestyle entity, you can't change. You can't change growing older. Now, family history of high blood pressure, because of any other of these metabolic disorders, that will predispose you to acquisition of blood pressure, hypertension, cholesterol. Now, race. African Americans have high blood pressure more often and more severe than white Americans. And the same thing applies to us here in South Africa. We mimic the Americans 100% in everything, illnesses, and can mention anything. Now, I will ask the pastor, so why God says it should be all blacks and whites? Why does he allow it that it should hate? And this metabolic disorders should be blacks more than whites. Now, the other thing is having chronic disease of the kidney. Now, those ones, the kidney are usually as a result of uncontrolled of any of the metabolic disorders. And then stress. Now, there is no proof that stress will, by itself, it will cause long-term blood pressure. It's not true. Stress, what it does, it just temporarily raises your hormones, like the endorphins, the adrenals, and the corticosteroids. Once you're stressed, all those hormones go up, and what's going to happen is the blood pressure is going to go up. And don't be stressed and go to see a doctor because he's going to diagnose blood pressure, and then he may, if you don't disclose your stress to you, you may diagnose hypertension, and yet you don't have hypertension. So those are the causes of high blood pressure, or the predisposing factors that we should look out for in these metabolic disorders. When it comes to diabetes, the stats are very scary too. In 2000, we had about 886,000 people having diabetes. And then in 2011, 10 years later, it was 1.9 million. And in 2024, it was 2.3 million. And then in 2050, according to the projections, in 2050, we'll be having 3.9 million people in South Africa who will be diabetic. Now, this is scary statistic. It does not matter what medical intervention you can apply, but we will, if we go any sleep, not taking care of ourselves, we will in 2050 have 3.9 million people having diabetes. And then we've got cholesterol. Many people ask me what is cholesterol. Cholesterol is that lipid part, the fat part of the body, which is responsible for manufacturing the basics of any individual cell. We need it. We need this cholesterol. And then it's also very good for manufacturing vitamin D, which is responsible for our bones. But now the sad part is that it gets accumulated in the blood vessels, and if you're not careful, you can end up with coronary artery disease or a stroke because of the clotting of the blood vessels. And then we've got obesity and CKD. Now, this diabetes and obesity, they become an epidemic now, especially in South Africa, as I speak now. We've got close to about 58% of people becoming diabetic. 58. That is more than half the population. Isn't that scary?
Yeah.
So, but it's combined to obesity plus diabetes, because we are growing into fat people in South Africa. We're becoming big every day. I'm also the stats, you see that. We're all becoming bigger, but that is not good. We have to do something about it. Now, this CKD is chronic kidney disease. It's also one of the metabolic disorders. I know we should be looking out for. But now, to acquire this, 60% of hypertensive will get kidney problem at the later stage. And then 35% of diabetics will get kidney disease at the later stage. Now imagine having hypertension and diabetes all combined. It raises your incidence of kidney disease to about 85%. So it's a double jeopardy, diabetes and obesity. Now if you add hypertension, the incidence goes to about 90%. So if you've got hypertension, diabetes, obesity, it's not good. You're likely to end up with dialysis. And then nowadays, dialysis is preserved for the money people. If you're from a low class or your finances are not good enough, you may not be dialyzed. You'll be left to die. Because once you've got this chronic kidney disease, where it has become irreversible, the only thing that will make you, or the only thing which will pull you, is dialysis. And then we've got very few machines, even in our public hospitals now. If you get a kidney disease today, for you to get dialysis, you wait 3 months. And with an acute kidney disease, you don't have 3 months to wait. And there are so many people who die because of lack of dialysis. And then if you are lucky enough, you can have a family member donating a kidney to you. And then, Africans, we want to die with our parts. So I will encourage for you, let us become donors of organs and also donors of blood. That saves life. I don't know if I'm making sense. So I'm encouraging everyone to become a blood donor or an organ donor. And then the last thing is smoking. Now, when it comes to smoking, I don't know, I can't emphasize it more than I have really emphasized in the past. Smoking causes all this causes smoking. So it's just like if you've got any of this and then you smoke, it's just like putting petrol, on a fire which is already burning. Now let's look at if you are not going to take care of these metabolic disorders, what is going to happen? Now, okay, this hypertension, but we skip it. All these are the same as that of diabetes. So let's go to the sequelae of let's just talk about diabetes, what diabetes is. Now, when you eat, the glucose, the carbohydrate or the food that you eat is going to be turned into glucose. And this glucose, it goes into the bloodstream, and then as it goes into the bloodstream, it has to go to the pancreas. Now the pancreas will signal, oh no, there is sugar here. Lower this sugar. And then it produces insulin. And the insulin will push the glucose into the cells. Now, for you to be diabetic, you have to lack this passage, this pathway. Because there should be no insulin at all, which is called diabetes type 1. Or you can have insulin, but it doesn't push the cell, the sugar into the cells. And that is what we call diabetes type 2. I don't know if you understand that. So a diabetic type 2 has got insulin, but it's just that the insulin is resistant. It doesn't want to push the sugar out of the blood cells into the cells. Right? And then we've got other diabetics like gestational diabetes, which is acquired from pregnant ladies. There are pregnant ladies who develop diabetes during pregnancy. The same with hypertension. There are those women who get hypertension because of pregnancy, but after delivery, they disappear. And then 15% to 20% of both diabetics and hypertensives don't get, proceed to be hypertensive. More and more, they have to be on chronic medication. Now, eating a lot of sugar, it's a myth, it causes diabetes. It doesn't cause diabetes. It only aggravates the insulin resistance peripherally. More and more, you are going to strain your kidneys at a later stage that they have to get rid of this high sugar. Not necessarily that you'll be diabetic. Because to be diabetic, it's either you've got no insulin at all, or your insulin is there but it's resistant. Now, it's uncontrolled diabetes and hypertension, including other metabolic disorders. The number one thing is stroke. Stroke. 42% of diabetics die from stroke if it doesn't go to the kidney. And the second thing is blindness. People are not aware that blood pressure and hypertension cause blindness. You'll be healthy and everything, just one morning when you wake up, you can't see. And then you go and see a doctor, they find that you've got what they call diabetic retinopathy, meaning you may have the light behind the eye, on the retina, where the eye interprets whatever you see. Now, with hypertension, we find X-rays which are called hard, and with diabetes, we find X-rays which are called soft. So it's treated differently altogether. The other thing is heart attack and heart failure. Heart attack is very common, especially in men. And heart failure is more common with females because they've got lower blood volumes, higher blood volumes than men. And then, when it comes to men, impotence is another thing which causes, which is caused by diabetes, and to an extent by hypertension. Now, the causation of impotence is when the blood vessels that supply the cavernous sinuses, which causes you to erect, are blocked. They're blocked by the atherosclerosis with cholesterol, or they're blocked from the sugar, which is from diabetes. So, don't be surprised if you change our very big if you're diabetic. But there is cure. There is help out there. You go and see your doctor, who will refer you to either a nephrologist or to a neurologist who will fix you up. And then instead of having to go to the MBZP in one of you. But in worse situations, there are some other people who leave their sugar to go sky high. Moreover, if it doesn't get all this, the blood vessels, we call it microvascular blockage. They are blocked altogether, and the leg dies. And then once the leg dies, There is no other way of reviving it except to amputate it. Now, all those metabolic disorders can lead to amputation of this. I don't know how I'm doing time-wise. Hypercholesterolemia, it can also, as I've said, it blocks. This is a normal blood vessel, atherosclerosis. Now you can see that the blood vessels are becoming blocked. We've got other organs, like in the periorbital area, the cholesterol can accumulate there, or in the legs, or on the fingers. Sometimes can be misled. Can be misdiagnosed as arthritis and be treated as such. When they should be giving you cholesterol treatment, that is statins. Well, I've spoken about obesity. These are exactly the very same things. So, blood vessel damage, heart attack, and kidney failure. See, typical from 1 minute guys. On a Sunday morning, most likely descendants going to buy chicken meat or something like that. And then renal diseases, we know that 60% is caused by diabetes, and then 35% is caused by hypertension. So, if you control your sugar, you control the blood pressure, you won't get to this. Not at all. Hypogonadism, we skip that one. I think I've spoken about this. That's the main menopause. I don't think it's so very important because of the time. And then we've got the men's mental health statistics. That lady was talking about exactly this. We men are teenagers. We've got a lot of anxiety. You can see about 40% of women, well, this studies, as I said, they equate to cancer. We've got a lot of anxiety. Depression, about 6.2%. ADHD. People thought ADHD, attention deficit disorder, they think it's only for children. It's not only for children, it's also for adults. Men are really, they are near about twice as likely as women to be diagnosed with this. But there is help. We can get one of our conclusions. Now, substance abuse. Now, many men immediately they can't deal with the problem. They resort to alcohol or drug. Now, this has become an epidemic among our boys because of the lack of teaching, because of lack of attention at schools. Bipolar disorder. The prevalence here is about 2.9%, which is not that bad. And then we also have PTSD, post-traumatic stress syndrome. They can't handle things like post-trauma. They need to be attended to. So these are some of the mental illnesses we should look out for, and we should also be looking for with our families. Now, when it comes to South Africa, the most psychological problems are compulsion, obsessive compulsion, and erectile dysfunction. Am I clear on that? that is what we suffer from, we South Africans. Obsessive compulsive disorder and erectile dysfunction. I think I'll stop there for because of time. I would say because I just want to take some couple of questions. According to me here, I think I've got 10 minutes left. We can take some questions if that is allowed. No. Men usually suffer from prostate cancer. I don't want to talk about it today because we shouldn't know these are the prostate doctor, and I'm not. So, most men get prostate cancer, and lung cancer, and colonic cancer, and then sometimes they get testicular cancer, but that one, it affects mostly the young men. Now it will depend what type of cancer you've got. The prostate is not one size fits all. we can treat that medication, and then if we can't succeed that medication, we can operate. And no operate the happen. There's new modalities now. We're using robotic surgery. More we don't open it at all. We put some holes. Yeah. I don't want to call them holes, pots. Then we operate through that. Then you can cure it sometimes. The cure rate we have robotic surgery is about 60-65. And then with the colon, it will depend on the staging. Stage 1, they can remove the colon and re-anastomose the part which is sick, and then it will be cured. And then with the lung can be very tricky in the sense that if you've got it on one side, that can be removed, and you are giving chemotherapy, and then you survive. But if it's both lungs, then it's a bit tough, because they can't remove those things. What they will do, they just dig out it. They will take whatever they can remove, then offer radiation and chemotherapy. And then now you be sentenced to having to move around with an oxygen cylinder because your vital data will be down. And when it comes to testicular cancer, you can remove the cancer, the testicle, which is involved, and then you go on normally. You can make babies with one testicle. You don't need both. Yeah. Yeah, that's true. But if this one is cancerous, remove it, provided it doesn't spread. But you can still remove that one, whether it's spread or not. You have to remove it, and then they give chemotherapy. Chemotherapy is that medication kills the cells. And then locally, you can give you radiation. But now, proving radiation is that it will kill the other one. It's dangerous. So, when the chemotherapy, you can excision.
Yeah, I want to make a follow-up.
Okay.
To say, is it advisable that I can use this treatment that we receive from you in those that we receive from the traditional doctors at the same time? Because some people would say, I suffered from this, then I used this, and it was a combination of the two, from the left and the right.
Yeah, but let me say, I don't advocate people to go and see traditional doctors, but we don't refuse you to go and see the doctor. There are some other people by now when they come to see us. They say, look, my name is Yana Manena, that's qualified. So, no, we do that. Don't tell people that I do that. I know there are people who don't believe in traditional medicine and they get cured. Funny enough, there was a guy who had a diabetic foot. He said he wants to go and see his doctor. He went there, he came back. That foot was healed. But now I wanted to see how they healed it. They refused. So you can encourage them to come and see us. But don't discourage them from taking the medication, because that's wrong. It's their right to take whatever helps them.
Thank you, doctor.